Hello, Namaskar. I am Dr. Dhwanee Thakkar. I am a pediatric hematology, oncology and bone marrow transplant physician. I would like to speak to you about hemophilia. Hemophilia is a bleeding disorder where the blood of a person does not clot properly and that person would have prolonged bleeding. Our blood normally has platelets and clotting factors. Clotting factors help our blood to clot properly. When a person lacks a clotting factor, that person would have prolonged bleeding. Hemophilia A is the deficiency of clotting factor 8 and hemophilia B is the deficiency of clotting factor 9. This condition predominantly affects males and females are usually carriers. However, females may be affected also in certain special situations. The age and type of presentation depends upon the severity of the condition. That is, in case of mild hemophilia, a person would have prolonged bleeding after a major trauma or surgery. Whereas in case of moderate hemophilia, the person would have prolonged bleeding even after minor surgery, minor procedures or injuries. Whereas a person with severe hemophilia is at risk of having spontaneous bleeds in large joints, muscles, in the brain and other sites of the body. The age at presentation depends upon the severity of the condition. In case of severe hemophilia, the child would present very early in life. The child may present in the neonatal period with a big hematoma over the scalp at birth, can have hematomas over the vaccination site, can have bleeds in large joints like knee, ankle when the child starts crawling and walking. Whereas in mild to moderate hemophilia, the presentation would be a little later when the child starts playing and gets injuries, has minor procedures, dental extractions, etc. This is a genetic condition. The gene for factor 8 and 9 is on chromosome X and it is inherited in an X-linked manner. That is, a person with hemophilia is likely to have family history of bleeding disorder. However, 1/3 of the mutations are spontaneous. That is, the person with hemophilia that is diagnosed would be the first person in the family to have hemophilia. This condition needs to be diagnosed timely. Diagnosis is based on coagulation tests and clotting factor assays. A genetic test, that is mutation analysis, can be done to confirm the mutation by exome sequencing. Once a patient is diagnosed with hemophilia, it is important to screen the family members for hemophilia. Also, genetic counseling is very important to be able to plan future pregnancies and siblings. The treatment option for hemophilia are many these days. The treatment includes replacement of clotting factors by clotting factor concentrates. Nowadays, extended half-life clotting factors are available which can be administered once a week and that makes life a little simpler. Also, there are other things like bypassing agents, bispecific antibody like emicizumab and several other drugs. When none of this is available, these patients may also need blood component support. Also, nowadays, gene therapy has started to be available as a permanent cure for this condition. These patients need to be seen in a multidisciplinary care setup to address their varied needs. The multidisciplinary care team would include a pediatric hematologist, an adult hematologist, a specialized nurse, a social worker and counselor, a dentist, an orthopedician, a physiotherapist, an infectious disease specialist, an obstetrician, gynecologist, a geneticist, a vocational therapist, and so on. These patients need comprehensive care. These patients may also develop several complications like a target joint, that is a joint which has had recurrent bleeds and has now become chronically inflamed, swollen, painful, and there is loss of range of motion. They may also develop inhibitors to the clotting factors that they have received. All these needs meticulous care and specialized attention. Thus, to sum up, hemophilia is a genetic bleeding disorder. Its timely diagnosis and optimal management are important. These patients deserve comprehensive care in a multidisciplinary team and care setup. Thank you.